We do have the Secretary of Health, Dr. Faith Brebnor. And of course, good morning and welcome.
Good morning, and I'm beaming because I'm listening to these young people, and I'm just so happy this morning.
How about you're happy this morning? I mean, I get all of what you just said, but I will try again. Yeah, just try again. You're happy because
No, I was listening to the feature and I saw all of those young people appreciating what is happening at the internship, and that made me smile.
very
Yes.
good. So we can start on a good note. All right. So the island was, the hospital had to be on emergency mode as a result of it being overwhelmed with patients. Before we get into that, Doctor, there is a strange presence of ailments all over the island with chronic beat, whatever, that seems to be obviously bombarding the health sector. Let's speak to why the advice of living a healthy lifestyle before we get into the painful truths.
So I think they go hand in hand. Um, the the individuals who are presenting at the hospital are or they seem to be unhealthier and they seem to be sicker. So it means that when they get to the hospital, they need to be admitted. And when they are admitted, they need to stay a little longer, which says something about their general health. And that, I think, is really the crux of the matter. As an island, we have to do all that we can do to ensure that we get back to a state of being healthy, because right now we are not at a state of being healthy, and therefore whenever any little thing, quote unquote, happens to us, we feel the full brunt of it because our baseline state is not in a healthy place. And I think I applaud you for starting there, because that really is the foundation of why we need to have this conversation, why the hospital has been overrun, and why we need to as the gentleman says, get back to our right self.
All right, you mentioned little thing. Tobago have, if I am almost sure, the largest amount of health centers throughout Tobago. And little thing, as you said, can be treated at the health centers. However, people prefer to go to the general hospital. Let's advise those who feel that they have to go, which they don't necessarily have to go because the health centers can treat with their circumstance. Let's speak to what is available at the health centers, and shouldn't that be the first option in terms of seeking medical attention?
It should be the first point of call. What unfortunately happens though is that people are creatures of what has happened to them. So you may have gone to the health center one time and the doctor wasn't there, or what you needed was not available. So you decided to go to where you know it will be available. So what we are doing is actually within the TRHA trying to beef up what happens at the various health centers, so that when people go to the health center, they are able to get what they need. So yes, we have the largest volume of health centers compared to population size, compared to even size of the island. The regular health centers do their normal clinics, their normal, where the doctor comes every so often. The nurses are there throughout. The nursing assistants are there throughout. The pharmacists may come depending on the situation. But we also have these enhanced health centers where we have, in essence, urgent care services provided. And of course, these are at Keenan, Bacalet, and at Roxborough. So we are currently refurbishing Charlottesville Health Center, but when that comes back on stream, we will have some more and some enhanced-ish type of services there as well. So yes, you are accurate, and that is part of what we are continuing to tell people, even with the release that was sent out, what was it, 2 days ago, that you do not have to go up to the Signal Hill General Hospital in A&E if you have you bounce your foot, or you have a cough and cold or anything like that. Try going to one of the health centers, see if those can provide the kind of services that you need, and only go to the hospital when it is absolutely necessary, when you are really in a dire accident and emergency kind of situation. But let me say one thing though, going back to the original question that you asked. The ailments that individuals are coming into the hospital that has been overwhelming the hospital have really been our non-communicable diseases. It's really been the diabetes and the high blood pressures and the heart diseases, which therefore lead to kidney failure, which therefore leads to the heart attacks, which therefore leads to amputations and those types of things. Those are really the things that we are seeing coming in. Of course, during cold and flu season, you see additional colds and coughs and that kind of stuff. But it's really the normal run of the mill lifestyle diseases that we are seeing coming in. And that is what is overwhelming the situation. And that is what, we can actively do something on an individual level, on a family level, on a community level to treat with.
And you mentioned two or three major health centers rather that provide or have doctor around the clock, so to speak. I myself went to Keenan and was treated, had doctor there, in fact two doctors, and then they sent me to the dispensary, and the dispensary was operating and so on. And that was a mini hospital in operation. The Scarborough Hospital does have that same service, and of course you mentioned Roxborough. Is there any plans to equip, and how feasible is it? I don't want to say feasible, but how important it is to have all the other health centers equipped with doctor around the clock or 24/7, or 12 hours a day? You tell me, is that part of the plan going forward?
So it's something that we're looking at, but it is not going to be very feasible. When we look at the volume of health professionals that we need to run all of the health centers and to have all of the health centers fully stocked all the time, we really just don't have all of the health professionals to do that. And to be honest, we don't need all of them to be functioning like that. When you look at our 60,000 population, when you look at our 116 square miles, when you look at the fact that, we only really live around the outskirts of the island, and you can get to a health facility relatively easily. You can get to a health facility in under half an hour, depending on where you are, one of those facilities. So it is not absolutely necessary for us to have that kind of system. But let me say, though, the TRHA has actually been tasked with reworking how we do healthcare in the primary healthcare system. So we're talking about the health centers. We've been pulling together the doctors, the nurses, all of the professionals who are part of that to determine what is the best way. And we will actually be rolling out a little shift in how we provide those types of services, so we are better able to treat the kinds of patients that come in. For example, allowing some of our more senior doctors to do what the senior doctors need to do, allow the junior doctors to do the entry level stuff, and so that it is stratified in that kind of way. And that way we would be able to see more patients, that way we will be able to run the clinics a little differently, and we will be able to do all of that in the primary or the health centers. That is the discussion that is currently happening right now, as a matter of fact.
All right, there's the argument that when we had the one hospital, and we're getting into the beds that are available and the shortfall of beds and so on, the one hospital up the fort, as we used to call it, handled all of Tobago, and there was never a situation where we don't have beds. Let's bring that into perspective. And then the whole answer or the question as to why isn't that whole hospital utilized in the event that there are, the one at Signal is overwhelmed. In terms of retrofitting and have it operational, it was utilized during COVID, and so there's that opportunity to utilize the space. But firstly, the question as to lack of beds and the whole hospital, given that there was one hospital. And when I heard that, I smiled, and I said, well, you're right. So Dr. Faith, tell us about that, what we know of that existed in Tobago for how many years, and there was never a complaint about not having enough beds.
Well, I don't know that there was never a complaint. What this situation may be is that we probably didn't hear about it, or they did not make a public statement about it. So that might be the difference. Or, we now live in the age of social media where something goes out and within 5 seconds, everybody has it. So I cannot say that it never happened. As a matter of fact, I am sure it happened. The thing that we need to note is I actually think that that hospital had more bed numbers than the current hospital at Signal Hill. I need to confirm that, but I think that is actually the case. So let's also go back to the fact that we do have the facility in up the fort. But remember, there's a reason why we moved from the fort to Signal Hill. I don't know if when the move was being made, if it was stated publicly, but there was quite a lot of infrastructural and other kinds of issues with the structure of the hospital up the old fort, which is one of the reasons why there was a shift from it to Signal Hill. The question you asked is one that we've actually tossed about. When we look at it, though, we recognize that what will be required to have some of our patients in Signal Hill and some up the fort would actually mean we would need almost double the staff to do it, because you need doctors and nurses and everybody doing what they normally do in Signal Hill, but you need those same kind of people to be doing what they need to do up at the fort, and we really just don't have the staff, we don't have the mechanism to run that. Remember, during COVID, what we were doing was actually isolating and separating people, and the people who were working, for example, up the fort for COVID, were not the same people who were working, or they shouldn't have been the same people who were working at Signal Hill. And we were actually telling people to stay home and not go to the hospitals unless it's absolutely critical and so forth, even during the COVID period. So it was a different kind of population, a different kind of population scenario that we were treating with. The professionals have looked at that, and we agree that it may not have been the best thing, but we are also looking, and I will make some of those announcements probably later on when the plans are finalized. We are looking at expanding what we do at Signal Hill, what we do with the property that we have. We are process of purchasing right now, of acquiring right now, which is the property right next to Signal Hill, and what we do in terms of expanding possibly Roxborough as well, to ensure that we take care of the population that we currently have. But more important than that, I would like us to think about taking care of ourselves. So, Brother B, I look at myself, last year or so, I recognized that I was gaining quite a bit of weight when I went to the doctor. Um, my cholesterol was very, very high. Dr. Duke gave me a very, very, very stern warning about my cholesterol and all of that. So I took it upon myself to start exercising and to start eating better and that kind of stuff. So that is also what we need to ask every individual, to take kind of stock of yourself and your family, to make sure you don't need the services that we provide at the hospitals.
Excellent.
That is what we're
So
asking
you're
people to do.
gym enthusiast. So you're going back in the gym. Well, that's congratulations. All right. But let's go now to this whole question. What do we do in the interim? I'm glad to hear that there is plans to expand what is. Let me just ask. Now that we have 100 beds, how many more beds are we intending to expand to with this new drive to expand?
I don't have the answer for that here. I actually need the team to work through exactly what is needed, because we need to do some projection as well. Even though the population is 60,000, we are hoping we're not doing the expansion just for us, just for today. We are doing the expansion with the understanding that our population size would increase. We are hoping that Tobago gets to at least 100,000 people to ensure that it is economically viable and so forth. So I've actually asked the team to do some projecting for me to see what do we absolutely need now versus what do we need in 5 years. And that kind of information we will provide once the team does the kind of build out that I am asking them to do. But in the interim, though, that is why we had the short term measure of having the 48-hour emergency hold. And let me just say it there that this this situation where the hospital was is overwhelmed, is a trend that we've actually been monitoring over the last couple months. So people, somebody asked me, how come suddenly this week it happened? It really wasn't a suddenly this week it happened. It's been happening. I've been getting the data from the hospital indicating, Dr. Faith, this thing is creeping up, it's creeping up, it's creeping up, and we need to figure out solutions for it. So it's not a brand new thing. I think what is brand new may be the fact that I am Secretary for Health. I am willing to have the conversations with the population instead of trying to keep it to myself, instead of trying to hold on to the information, to hide it, because somehow, because the hospital is overwhelmed, that may make me look bad. I don't particularly care about stuff like that. I am leading an organization, and part of leading the organization means communicating with the population who we are serving, so that we need you to know what you need to do as well. And that is why you are hearing about it. But it doesn't mean that it was not happening before.
Very good. All right. So where are we now with of course, the emergency situation is lifted and we are back to normal?
You are going to get a notice soon that it will be lifted today. I got a report about probably 2 in the morning from the professionals there, indicating that we have been able to do some kind of balancing back, for want of a better term, where we do have all of our patients who were waiting in A&E to be admitted. They have been admitted, so we shouldn't have any patients sitting in A&E waiting. We have a few additional bed spaces as well in both the adult ward and surgical ward. We have those spaces available. So we are going to, in essence, lift the hold on elective surgeries. And let me just talk about the elective surgery for a little bit. In essence, emergency mode means that you only do what is absolutely necessary, right? It means that you halt elective surgery. So, what are elective surgeries? Elective surgeries are surgeries that the patients need. You absolutely need to do it, but you don't need to do it right this second. It's not a life or death type of situation where it needs to happen today, today, today. Because remember, if our surgical ward is full, even after you've done an elective surgery, you still need to go into the surgical ward to recover, even if it's just for a day or two. And that is where we did not even have the bed space to send you into the surgical ward to recover for the day or two. So that is why we were saying, if you have an elective surgery, let's hold it off for a couple days, a week or so. We'll bring you back in after this is balanced. But yes, I did get that report very late last night that we are in a much better space, and therefore we are able to go back to, in essence, what would be classified as normal functioning at the Scarborough General Hospital.
There's also, we can't ignore, given that we are in the hurricane season, if there is a disaster, there been a conversation, given that this is a normal, well, this is in a normal situation where we are overwhelmed, and we can't ignore, God forbid, that there's a disaster. Are we ready for any eventuality in that regard?
Now, the good thing about where we are now is that disaster management is coordinated by the Tobago Emergency Management Agency, TEMA. And the TEMA was actually gifted, I think it was last year, maybe the year before, from the US Embassy, I think it was, a hospital that is a mobile hospital that we can deploy immediately in the event of a disaster. So yes, we do have the capacity to get immediate bed space quickly in an event of a disaster, because we have been doing mass casualty training and that kind of stuff. We have, I think we are in a better place to respond if something like that happens, where all of the different entities know what they are supposed to do and know what their functions are and so forth. But we are praying and hoping that that does not happen. But if push comes to shove, we do have that capacity. And the good thing about emergency management is that whenever an emergency is declared, depending on the category of emergency or depending on the level of the emergency, we can quickly escalate to determine whether it is one that locally we can treat with. And if we can't treat with it locally, we reach out to our brothers and sisters in ODPM in Trinidad. And if we can't treat with it as a country, then we reach out to our partners in the region with SIDEMA and so forth. So the mechanisms are there to treat with that if we need to.
So we got the, as you said, a statement would be made today as to the readiness of the hospital in terms of returning to normalcy. Just to repeat and to be clear.
Yes. So a statement will come out from the TRHA at some point this morning to indicate that we are going to return to normal functioning. I didn't hear that for last part.
I said, welcome back to keeping fit. I know that you were in a gym with deceased, my good friend there, and so on. And yeah, so hope to see you back on the road. All right?
Certainly. So I have actually been going to the gym, and I haven't been able to do aerobics since then. Honestly, I still think of him, and it's still sad when I try to do aerobics. But I'm doing the gym, I'm doing running, I'm doing other things.
All right. Thank you again.